Are you trying to get pregnant in 2023? Well, today I'm going to share with you how Tempdrop can help you do just that. In order for pregnancy to occur, we need to be having intercourse within our fertile window and as close to ovulation as possible. There really is only a 6-day window that conception is possible, so being able to detect and confirm ovulation is critical to being able to get pregnant. You may have heard that women ovulate on day 14 of their cycle. However, this is only an average and it's based on women having a 28-day cycle. But in reality, women's cycles fluctuate. And some studies have even found that as little as 10% of women ovulate on day 14. What this can mean for some couples is that they are missing their times of fertility and ovulation altogether and trying to get pregnant on the wrong days of their cycle. So how do we know when we're ovulating so that we can best time intercourse for conception? Well, we can use a couple of methods, including cervical mucus observations and LH testing to detect when ovulation is likely to occur, and then BBT or basal body temperature monitoring to confirm that ovulation has in fact taken place. So let's talk about cervical mucus. Tracking your cervical mucus helps us to identify when your fertile window has opened and gives us clues that ovulation may be around the corner. Your cervical mucus changes throughout your cycle as your hormones change. Our main female sex hormones, estrogen and progesterone, influence the kinds of cervical mucus that we see throughout our cycle. So you may notice a change from dry or not really anything visible earlier on in your cycle to a change or an increase of cervical mucus as you move closer to ovulation. And for a more comprehensive overview of cervical mucus, there's a great lesson contained inside the Tempdrop app. And as you make your observations of your cervical mucus, you can make note of them and any other fertility signs like LH testing right inside the Tempdrop app also. So once you've established that you're in your fertile window, you can now try and time intercourse to ensure that you are as close to ovulation as possible. So research has indicated that the likelihood of conceiving is dramatically increased if intercourse occurs in the 3 days leading up to and including the day of ovulation. Some couples choose to have intercourse every day or every second day within their fertile window to ensure that they're maximising their chances of conception. And now we need to confirm that ovulation has taken place, and that's where Tempdrop comes in. So with the use of Tempdrop's wearable thermometer, we can track and record our basal body temperature to learn in retrospect if ovulation has occurred. So there are 2 temperature phases throughout the woman's cycle. And prior to ovulation, in the follicular phase, your basal body temperature is slightly lower. It then increases in response to progesterone that is produced at ovulation and remains high throughout your luteal phase until your next period arrives. So combining temperature readings with other fertility symptoms really helps us more accurately identify your fertile window.